So my involvement with the ototoxic patients were after we realized that a lot of these children who were having treatment for childhood cancer were going deaf, and a lot of them were really very emotionally affected. But when the diagnosis was given to them, there was an issue with acceptance. The parents were getting upset, and sometimes the 8 or 9 years old child, as soon as they found out they have a hearing loss and may need to have a hearing aid, and they look at the hearing aid, and in those days 13 years ago the hearing aids were quite a sizable size, they would just run out of the room crying, and then they wouldn't want to come back and see me. So we then developed a database where we were looking at all the children who've undergone childhood cancer treatment, and we divided the database in children who had normal hearing following treatment and children who had hearing loss. And we did a literature search and realized that there are no studies on quality of life done in these children and families, and we then decided to run a quality of life. I had an MSc student who wanted to have an MSc project, and I said, fine, we'll supervise you, do send out these questionnaires. So she did, and she did most of the legwork, and we collected the data and we analyzed it, and the results were partly predictable, but we had that then in black and white, that these families, these children were struggling more than the children and the families who did not develop hearing loss secondary to the treatment. So the quality of life, we chose two types of questionnaire. One was a generic questionnaire, which is used in any disease condition, and it had 8 domains, and a scoring system was identified, and basically we scored them between 0, which is the quality of life when somebody dies, and 1 when it's the best possible health. And that showed quite clearly that the children who did not sustain a hearing loss, their quality of life was better on that grading scale than the children who developed a hearing loss. Then we also chose a disease-specific quality of life questionnaire, which is children which was developed actually children who had a hearing loss. And we then applied that same disease-specific quality of life measure to our two groups of children who did not have a hearing loss, children who had a hearing loss. And again, we found that the quality of life in communication, in academics, was worse in children who had hearing loss. But what was really stark, was very interesting, was that the peer group, how they were viewed by the peer group, was very important for these children, and hence wearing hearing aids make them different, and they really want to be like all their friends, and their self perception, i.e. their acceptance of hearing loss, was way down, way worse than any of the other 3 measures that we looked at. So I mean, this was something that I had noticed, that these children had low self-esteem. They saw themselves as not very capable as compared to their peer group or children who didn't have a hearing loss. So I feel that not only that their hearing loss impacts on their ability to listen in challenging listening situation or hear, but also the way they perceive themselves is also quite, to me, came across as something important, and it should be identified.